Star Wars actress Daisy Ridley. She's opening up about how she's taken control of a secret health struggle, battling endometriosis since she was just 15 years old. It is a painful condition that affects an estimated 1 in 10 women. ABC's Lindsay Davis has her story.
She plays the fierce, headstrong Rey in a galaxy far, far away.
I'm not giving you anything.
We'll see.
But Daisy Ridley is now revealing a secret that hits much closer to home. Writing in a post on her Instagram account on Thursday, at 15, I was diagnosed with endometriosis. 1 laparoscopy, many consultations, and 8 years down the line, pain was back. More mild this time. Finally found out I have polycystic ovaries, and that's why it's bad.
Endometriosis occurs when normal uterine lining tissue grows outside of the uterus and causes pain, and polycystic ovary is more of a metabolic syndrome.
Endometriosis is hard to diagnose and occurs in women of childbearing age. Ridley also says her skin was the worst.
Patients with polycystic ovaries can have high levels of male hormones, and that can cause acne.
But she goes on to describe how with some dietary changes, she's feeling better, saying, with some help from a dermatologist and cutting out dairy, wham, except for spontaneous ice creams, and cutting down sugar, bigger wham. But gotta do what you've gotta do. And her advice, take matters into your own hands. To any of you who are suffering with anything, go to a doctor, pay for a specialist, get your hormones tested, get allergy testing. For Good Morning America, Lindsay Davis, ABC News, New York.
It's great advice, and now we have even better advice. ABC's chief women's health correspondent, Dr. Jennifer Ashton, is joining us right now. How common is this to have endometriosis at 15? And she also threw in the polycystic thing. Let's talk about both of those.
Yeah, so endometriosis, really important. A lot of people think that teenagers can't get it. They can get it, and they do get it. So follow me on this one. One of the symptoms of endometriosis is severe menstrual cramps. That's common in teenagers. That in and of itself is undertreated and underdiagnosed. The gold standard to treat painful periods, the ibuprofen class of medication and low-dose birth control pills. Studies have shown that in teenagers who do not have their pain relieved with both of those 2 treatments, over 50% of them will have endometriosis diagnosed in surgery. It's important to make that diagnosis.
The birth control can actually help.
It's one of the treatments for endometriosis. So it's important to get ahead of this before 10 years goes by and it can do more damage.
So many kids do have, or young ladies have big, big, deep cramps.
Absolutely.
Are you saying go to a doctor, don't self-diagnose, don't just
100%. They should see an adolescent gynecologist because, again, it's 2016. These symptoms should be treated. When you talk about the PCOS, however, that is completely unrelated to endometriosis. 2 common GYN conditions. Both of them can cause some problems for women. They can both affect fertility, and they can both increase the risk of certain types of cancers. So again, awareness is very important.
You just said it, polycystic ovarian syndrome.
That's right, PCOS.
Daisy said, oh, I found out it's not this, it's that. You're saying they're 2 different things?
They're unrelated. She got an improvement in diet, which can be really helpful for PCOS because that's when you want to minimize sugar. But again, I always say when you're dealing with any chronic condition, you want to treat the whole body, not a body part. So diet's always important.
Don't self-diagnose. See a doctor.
Ideally.
Yes. Yes, ideally. But thank you always for great advice.